everybody to the morning Board of County Commissioners meeting for October 6th, 2020. We have a really full agenda today. We have a 10 a.m. time certain. Some emergency business will get out right in the beginning of the meeting, and an afternoon executive session. I'm going to read us in with some information for the public who's watching. The public who is watching, you're registered to watch this meeting in our system as attendees. Attendees are webinar participants who are simply viewers of the meeting. Your microphone and your webcam are automatically muted as attendees. However, there will be a time in the meeting where we will open it up for public comment. And when that time comes, if you wish to participate in public comment, I'll ask if you can raise your virtual hand to be recognized. There should be a hand icon on your device. When the public comments, our meeting organizer will call names, and when your name is called, you'll be unmuted and given 3 minutes to speak. When your 3 minutes is up, you'll go back into muted status, and the next person will be called. And then you can watch the rest of the webinar as long as you choose. We'll try to give everyone present some time to speak. In the event that there are more people wishing to speak than the time allots, I may need to limit the number of speakers and/or reduce the time allotted to each speaker, or select speakers randomly. We have not had to do that so far all year. With that, we'll move straight into our agenda. Are there any adjustments to the agenda at this time from anyone?
Chair, this is Pete Sorensen. I'm on the phone for now. I just wanted to ask a question about the way the meeting is likely to unfold today, and specifically, do you have a range or a guess on the start time of the executive session?
It will be in the afternoon, most likely after our items for Public Works.
Okay, thank you so much.
Mm-hmm. Okay, with that, I don't hear any other adjustments to the agenda, so we'll move straight into our emergency business, which is a meeting of the Board of Public Health. So we will recess our regular agenda and open the joint meeting of the Board of Public Health and the Board of County Commissioners. And we'll move into item number 1 on that agenda. Any adjustments to the agenda? Hearing none, we'll move into emergency business. Any emergency business? Hearing none, we'll move straight into item 3, Health and Human Services. Item A, Order and Resolution 20-10-06-05 in the matter of declaring a local public health emergency in Lane County due to hazardous waste and materials created by the Holiday Farm fire. With us is Jocelyn Warren, Public Health Manager. And Mr. Mokryski, I'm not sure if you want to speak at this time as well.
We'll give it to Jocelyn.
Jocelyn, we'll need your audio.
I can't believe I did that. I'm usually so good. So good morning, and thank you for having me. This involves recognizing that a state of emergency exists within the county as a result of the Holiday Farm fire, in order to make additional support from the federal government and the Federal Emergency Management Agency public assistance available to us in the county. I think it's otherwise pretty straightforward, and the order and resolution simply declares that a local public health emergency exists, which is what FEMA needs in order to be able to assist the county.
Thank you. Any questions or comments? I see Dr. Lucky in the background there.
We're preparing for our next presentation.
Very good. Commissioner Bozievich.
So I guess 2 quick questions, and one's kind of a repeat question. When we first entered into the agreement with the state on debris removal, just want to ensure that declaring this emergency isn't going to quickly force cleanup of residences where they won't be able to take the time to document foundations or ash locations, to document actual footprint of existing buildings prior to any removal of any hazardous waste. By declaring this emergency, we're not going to preclude property owners from making sure they do that they have time to do proper documentation to be able to apply for to have that evidence for replacement dwellings.
I could say from my understanding is that the emergency declaration allows work to begin immediately. It does not require that particular actions are required immediately. So I cannot imagine that they would not allow for individuals to do the proper documentation of their current circumstances. I'd be happy to follow up with that with our county council if that would be helpful.
Chair Buck, Commissioner Bozovich, I can answer that question. Even though this is the first step to allow hazardous waste debris cleanup, the individual property owners are still going to have to sign we call it a right of entry. So that will give them the opportunity to do whatever they need to do for granting that right of entry.
So that leads to my second question, which is there's a lot of concern about the right of entry allowing for billing of homeowners insurance for hazardous debris removal, and whether that will be taking away from the total insurance claims and the ability for people to rebuild their homes because they're only covered for a certain amount of their home. Is that, can somebody clarify for me if this entering into this right of entry to allow for the state to do hazmat work, and then they bill an insurance company, is that going to hurt somebody's total claim and ability to replace their home?
Chair Buck, Commissioner Bozovich, that issue has been raised that there are different kinds of policies. Some include a specified cap for debris removal. The type of policy you're talking about, the Insurance Commission refers to as a Type B. So that means that the homeowner needs to be in contact. We're working this out in terms of who's going to be responsible for this. It's going to be the state, but it is the individual homeowner. I would recommend strongly that the individual homeowner contact their insurance company and find out what kind of policy they have to make whatever election they have. They're entitled to under the policy. I don't think we're going to be able to do that for them.
So I guess maybe just it'd be great if staff is somehow or another educating folks prior to taking in any right of entry and maybe asking if people have been in contact with their insurance companies and possibly even an attorney to make sure they understand what they're agreeing to. Because I want to make sure that as we approve this declaration, that the ultimate actions is to get the state and FEMA to subsidize and quickly remove hazardous material out of the watershed, which is a great thing. But I also don't want to have homeowners accidentally not being able to replace their homes because they used up their insurance on a hazmat disposal.
Yeah, the right of entry has a place where they have their where they list their insurance information and their policy. So, like I said, again, it's my understanding we are going to do some of that education and telling folks if they have questions to call the State Insurance Commission after they talk to their insurer.
Great, thank you.
Commissioner Burney.
So I want to kind of get back to what resources does this emergency declaration enable the county on behalf of homeowners to access? And what is the time frame for the work that will be done and supported under this emergency order?
Steve, do you want to take that?
Sure. Chair Buck, Commissioner Bozovich, or Commissioner Burney, basically this is a legal step. It's a little bit like when we do the conflagration thing, where basically this is the first step, and it's my understanding that the the first phase, so we declare the public health emergency that triggers the ability of FEMA and the state to access these resources for federal resources for the cleanup of this. And that it goes in different phases, and it's my understanding that they want to, at least from the calls that I've been on, they want to get started as soon as possible. And this is the first step, and then of course they also need the right of entry from the signed right of entries from homeowners. And I like to get as many of those in a cluster as they can, because it's far more efficient to have a group of them together so they can go from place to place to place, as opposed to doing residents or whatever. So what this does is this allows for residents to have the ability to access this hazardous waste cleanup funds from FEMA.
Thank you very much, Mr. Dingle. So I would just like to say that, I don't know, perhaps other commissioners have experienced this, but I experienced a home being destroyed 31 years ago by a natural disaster. I experienced having to deal with government processes, permits, FEMA loans, etc. And I can tell you that while, of course, homeowners need to be concerned and in control, that this is far, far more complex than anyone coming to get you. This is, in fact, attempting to provide resources. It's going to require mass conversations, I can tell you from personal experience, with insurance companies. Everyone has different insurance companies with different caveats. It's going, and I hope that we as a county later today look at ways in which we can help get people back into their houses in a pragmatic and practical way as soon as possible. So I will vote for this, because all we're trying to do is help. Thank you.
Commissioner Farr.
I particularly like that last statement, Commissioner Burney. All we are trying to do is help. And in fact, that is our goal universally. You know, I experienced a house fire when I was 12 years old. It destroyed about half of our home, and it is devastating. And insurance and replacement of what you had before should be the least of your worries. What you have lost is going to be at the top of people's minds. So taking away as much worry as we possibly can. And Commissioner Bozovich, I appreciate your line of questioning regarding documenting what was existing, because I personally am adamant that destroyed dwelling units should be replaced as in the positions that they were, if that is the if that's the desire of the owner. As a minimum, you know, I hope and expect that we all, and most people agree, that the current housing emergency that we are in, that we've been in since before the Holiday Farm fire, since long before the Holiday Farm fire, a net loss of residential units is not acceptable. If we lose residential units right now, then we're not doing what Commissioner Burney just stated, trying to help people. I'll again add that an increase in residential units is really an opportunity for us, and that's something that we should be looking at as much as possible. So I appreciate the line of questioning, and Dr. Warren, I'm fully behind the request that is being made, and I will back the request.
Chair, this is Pete.
Yes, go ahead.
I just wanted to ask why we haven't done one of these before when we've had forest fires in Lane County. I believe this is the first time I've seen a request like this. Could someone answer that?
That I cannot answer. That precedes me. Maybe Steve Dingle has more information.
Sure, about Commissioner Sorensen, I can only assume it's because none of those other forest fires involved large-scale damage to residences and structures. That's the purpose of this, is to remove hazard nodes.
That is correct.
Is this being done in conjunction with EWEB regarding the possible protection of the Eugene water supply?
From what I know in this process, EWEB and our utility partners will all be at the table and included in the conversation. This is a statewide assembly in order to move forward on hazardous waste and general waste cleanup, since we were also approved for Category A natural disaster FEMA declaration as well. So this is happening around the state, not just our county, but it is a key item to move forward in order to continue on the linear process that FEMA requires to assist the counties. The ask that Commissioner Bozovich presented is valid. I already talked to staff about that yesterday or the day before, and they are on the messaging. We do need to clarify the information surrounding insurance on this. It is going to be a really significant lift for people to navigate through recovery after all that they've been through. So it behooves us to be as open and transparent and communicative as we possibly can to move forward. I would encourage everybody to continue to be positive about how we move forward. Any other final comment on this item?
Chair, I just would add everything that you said was accurate, and I just want to make it clear that so the board knows, and you'll hear later this morning from Dan Hurley, who's our incident commander for the Fire Emergency Operations Center. And as we begin to transition, we've transitioned from response to recovery on the fire. We're now going to begin to transition our Emergency Operations Center into 4 task forces focused on housing, human services, debris management, and watershed. And so to the question of whether or not EWEB and the other water and utility districts that are affected by this fire are all full and complete partners in this recovery work, along with a number of other organizations in the community. And again, you'll hear more about that in the fire update in a few minutes.
Thank you. So is there a motion to approve Order and Resolution 20-10-06-05 as presented?
So moved.
Second.
Moved by Commissioner Burney, second by Commissioner Bozovich. Any discussion? Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed say nay. So motion passes unanimously. Thank you. So we will adjourn the joint meeting of the Board of Public Health and the Board of Commissioners, and we will resume the Board of Commissioners regular meeting for today. The next item on the agenda is public comment. So those that are interested in making any public comment this morning, please raise or click that virtual hand, and I'm going to turn it over to the moderator.
Thank you, Chair Buck.
Okay about you.
At this time, if you have joined our meeting to participate in public comment, please raise your virtual hand and I will call on you to give your public comment. I will unmute you and start the timer. The first person I see is Nicole DeGrasse. Nicole, I will unmute you and I will begin your timer. Thank you. I do show you are self-muted. There you go.
Good morning. So I just wanted to, first of all, thank you, Commissioner Sorensen. I have sent a few letters to members of the board, and I appreciate the fact that Commissioner Sorensen responds. And, you know, it's kind of nice having a discussion. So I appreciate that. So thank you. Y'all are getting a lot of practice in passing emergencies this year, unfortunately. So I basically just wanted to ask if you guys could ask Lane County Public Health these questions. And some of this stuff I've kind of covered in emails previously. I just feel like the consequences of testing protocols and transparency issues, they have significant consequences. And so that's one reason why I'm giving public comment today. I'm concerned about the testing increases. I'm concerned that the public health department isn't looking at anomalies. I would like to know, are they retesting to confirm these increase in testing, especially when so many are asymptomatic? I've previously let you guys know that Thermo Fisher, which is the state's contracted lab, has many problems with false positives. In fact, they're in court right now. They're being sued for false positives with drug testing, where they put 2,000 people in prison. And I know there's cross-contamination issues. There's dozens and dozens of articles I've read that PCR tests, not only are they so sensitive, but they can pick up viral fragments in a lab. And I just think if we're going to do anything like threaten the public with going back to phase 1, or scare people into thinking that there's this rapidly spreading disease, then we need to really take a look at the testing protocols. These anomalies went from 20 to 199 in a few days. And I know there's college students in town, but from what I read in interviews, the college students weren't symptomatic. So the consequences of unreliable testing protocols are very significant. And I just want to know, what reassurances can Lane County Public Health give that they are using best practices, looking at the actual data, reconfirming tests by doing retests. And I was just thinking about Clatsop County. OHA reported that they had a huge outbreak in a seafood plant. Well, then when they met with the public and took questions and answers, it come to find out there were 0 hospitalizations. Most of them, they said, the majority were asymptomatic. And so, is asymptomatic mean they're carriers, or does that mean there's false positives and they can't replicate a disease and spread any illness to people? And I think these are questions that need to happen. The director, Pat Allen, said, well, it's an emergent discussion. And I just wanted to bring that to light and find out what Lane County Public Health is thinking, especially just the retest part.
Your time has elapsed, so thank you for your public comment.
Thank you.
At this time, I do not show any other hands raised for public comment. If you would like to give public comment, please raise your virtual hand and I will call upon you. Chair Buck, I do not see any other hands raised, so I will turn the meeting back over to you.
Very good. Thank you for your public comment. Are there any commissioners' response or remonstrance? Commissioner Burney?
I want to thank Ms. DeGraff for her comments, and it seems as if she's sort of listed some questions that I've written some of them down. I couldn't write as fast as you were identifying them, but if they're not answered in our report from Director of Public Health here momentarily, then I'll make sure they get asked. Thank you.
Okay, Commissioner Park.
Thank you, Chair Buck, and thank you, Ms. DeGraff, for your testimony this morning. I just read reread your September 30th message to us. Contains a lot of information, much of the same questions you asked today. Chair Buck, I just wanted to mention a thank you to a couple of our local legislators while we have a second. Senator James Manning and Rep. Marty Wilde were both present last week at the Association of Oregon Counties Veterans Committee retreat. I serve as the co-chair of that committee, and both Manning and Wilde are veterans. I took time to spend the entire afternoon with the Veterans Committee, answering a lot of questions and providing a great deal of confidence that the veterans issues and veterans affairs will be heard in the legislature, in the upcoming legislature. So just wanted to pass that along, and thank you once again to Senator Manning and Rep. Wilde.
Any other remonstrance? I just want to note that Ms. DeGraff and I have had emails, correspondence as well, and I always appreciate the feedback. Okay, we'll move on to item 5, county administrative issues. Item A, our COVID-19 response and recovery. And with us is Mr. Mokreisky, our county administrator, and Karen Gaffney, Director of Health and Human Services.
I'll just say, Chair, and I believe that we have Dr. Ludke with us and Dr. Warren as well. And so you have lots of great folks to provide some information and answer questions. I'll say that as the board knows, we were around 7 months of managing this global pandemic. that Lane County has been leading the response to on, and going on about a month and a half of response and moving into recovery for arguably the largest and most destructive wildfire in Lane County's history. So a lot of work happening, and our teams are stressed in terms of just resources that are available to respond to these efforts, but folks are doing an incredible job and really appreciate that work. Ms. Gaffney is going to walk through the update with you. As we talked about last week, the county and as a public health authority has limited enforcement powers, and Ms. Gaffney can touch more on additional work that we've done to evaluate what options the county has and powers it has available to it. And so you're going to hear a focus today on continue to pursue aggressive messaging in the community, an update on what we've done and what we plan to do, and then two, more discussion about allowing for the collection of complaints and collaborating with cities and other partners on response, and really trying to work in a collaborative manner to get our case numbers stabilized, under control, and beginning to decline. So I'll turn it over, Karen, to you to walk through the details.
Thank you very much. And yes, we want to take a slightly different approach to our briefing this morning. And we do have both Dr. Ledke, our Senior Health Officer, and Dr. Warren, our Public Health Administrator, who are, there we go. Now, hopefully they can share their screen as well. Our plan today, I want to have do a few opening remarks, and then the three of us will share a presentation on the data, situation, options, and recommendations moving forward. I want to start with just an overview of the numbers. I know these are available on our website, and I think it's important to stay grounded in the data. We do see a continued increase in the number of cases in Lane County. As of yesterday afternoon, we had a total of 1,545 people who had positive for COVID in our community. The number, as you know, that we track most closely is how many are currently infectious. We had 265 people currently infectious at the end of the day yesterday. 7 of those people were in the hospital, and 20 people have passed away connected to COVID in our community. Another number we've started talking about the last few weeks with the board, as the number has increased, is how many people are under monitoring in our community. We had 555 people under monitoring yesterday, and those are people who are close contacts of someone who has tested positive for COVID. So they are currently in quarantine in our community, and we're checking in with those people every day. So that's that data tells you why our top screen here is our high alert message from our website. I think it's important to remember we're not in this alone. This is clearly a national issue. And we're seeing cases increase in many parts of the country, many parts of the state of Oregon. So to keep that in context, here close to home, last week we saw Benton County was placed on the governor's watch list. And we'll talk a little bit later about what the watch list is and isn't in Oregon. But what I want to emphasize here for the board and the community is several months ago, as you know, Lane County and the University of Oregon partnered to really create our own watch list. We have on our website 6 specific community data indicators that we track on most closely, that then translate to what level of alert should we be paying attention to in our community. And as we talked about last week, given our data, we have now moved into high alert level in our community, and it's important for everyone in Lane County to understand that given the prevalence of disease in our community, it's important that we change our behaviors in response to that in order to gain control of the disease, bend the curve, and really be prepared to go into winter in a way that does not tax our healthcare delivery system. So that for those in the community, you can access the data as well as the alerting system on Lane County's website. Couple things since last week before we launch into talking about recommendations moving forward. The board talked a lot about the importance of messaging, and so I would like to give you an update on that activity that we've undertaken since we last met. And I need to give huge credit to our very small team in our public information office, led by Jason Davis, who really has been working hard to galvanize our community partners around messaging, and I think is doing a tremendous job of embracing an all hands on deck approach. We need to mobilize both our earned media and our paid media and focus on really targeting messages in a way that's going to lead to behavior change. And that's a theme you'll see through our conversation today is I would guess most people in this community know that public health thinks you should wear a mask. So really the challenge now is getting you to actually change your behavior. And what we know in terms of effective communication is you're most likely to do that if you're hearing that message from multiple sources and sources you trust. So that is a piece of galvanizing our community partners in that way. The county administrator and I meet weekly with city managers. We had a really great meeting at the end of the day yesterday to reaffirm their commitment to this. We know that people in cities are closer to community in many ways than we are. We heard from city managers that they are committed partners for us in this continuing effort to develop behavior change in our communities. And we'll talk more as we go through this, but there's also efforts with the business community, again, to do the same of how do we target messages in a way that's going to result in behavior change. So I'd like to just quickly read through what is actually a pretty long list of our communication efforts from this last week, just so that the board and the community understands, even if you haven't seen a particular spot on the media, I want you to know what is out there as we move through. And again, we have about 3 people on our in-house team that are helping amplify this with the larger community. And we're making between 2 and 2.5 million impressions weekly in our COVID work. We continue to do biweekly press conferences, and thank you, Chair Buck. I know you made an appearance last week again, one of many you've made during the course of the pandemic. We use that as a primary way to help get information out for earned media, as well as the public, and broadcast those live on Facebook. Our public partnerships are where key messages are shared widely. We have an agreement with all of our public partner PIOs to really magnify and amplify social media posts and key messages for uniform messaging. We're working closely with the University of Oregon in a partnership with public health that includes weekly meetings to strategize social media campaigns and peer-to-peer marketing. Again, we know as we try and change student behavior, they're much more likely to positively respond to that message if it comes from a peer. So activating those networks. We also have a new Key Communicator Business Alliance. And again, that's the same principle as our public sector agreement, really encouraging our business partners to develop unique and creative ways to further that public health messaging. In terms of broadcast television media, we've had daily news stories, and particularly featuring Dr. Ludke, and a PSA that he recorded is running on all of our non-news programming on KEZI and KVAL. And then we have daily news stories on KEZI, KVAL, KMTR, KGW, and KATU, with those Portland stations being at least weekly news stories. We're also, you can hear us on radio. We have daily news stories on KLCC and KUGN and KEPW. We also have been broadcasting on the Spanish language stations and bi-coastal radio stations and KNND. For print media, we've had weekly news stories in the Eugene Weekly, daily news stories in the Register Guard, including, I don't know if you saw a really fantastic piece yesterday highlighting our contact tracers and the work that they've been doing here in Charlton. Weekly stories in the Oregonian, monthly news stories in the Willamette Week. We're at least weekly in with the Emerald and the Torch, the Siusla News, and the Cottage Grove Sentinel. We have purchased outdoor advertising on traditional billboards as in both Eugene and Springfield, and a digital billboard on I-5 on the Springfield side. We've engaged with transit and purchased Mask Up campaign on EMX buses, flu and COVID campaign on the normal bus routes, and we have a full bus wrap coming in November. And then, as all of you know, so much of communication has shifted to social media. So we have a strong Facebook, Instagram, and Twitter presence with those messages coming out multiple times a day. And then really working hard with the University of Oregon to use those social media channels that are more frequently used by young people in our community. And they've been doing a fantastic job of amplifying the message there. So thank you for letting me walk through that. I think it's important for the public to know that the messaging piece is critical for us, and we are leaning heavily into that strategy. And it's connected with partnership activation. So U of O, cities, and business are critical for us. And then before we turn to the other data, I wanted to spend just a moment talking about the strategy that the county administrator gave you a tip on at the beginning, and looking at strengthening our call center. And again, we have a call center that's open from 8 to 5, Monday through Friday, and the community has used that throughout the pandemic, both to get critical information in terms of their own personal health and symptom checking, as well as information about what's happening in the community to respond to COVID. And throughout the pandemic, we also have had complaints. That's a place for the community to call and say they're concerned about particular businesses or particular activities in the community. And because that call center is an existing source in the community, that's an opportunity for us to strengthen that effort in the community. So I want to forecast for you and the community that we will be increasingly promoting that as a resource for people in the community who are identifying hotspots or areas of concern, to be able to have a place to call or email with that information, and know that we will follow up and connect them to the right enforcement entity that exists. As you know, it depends on the type of activity. If it's a restaurant or a bar, Lane County has a presence with restaurants and license those. OLCC is, of course, the licensing entity for bars and many restaurants, so we'll partner with OLCC. OSHA is the enforcement agency for workplaces, so we have partnerships there. Most importantly, our first line of defense is going to be education. So this will give us an opportunity to reach out directly to those businesses or those entities and make sure they understand what the guidance is and what's expected of them, and provide them those resources. And if we know where there are egregious problems or hotspots, it will give us that data to be able to respond deeply to those. Again, working hard to use that data to get in front of transmission and spread. So those are a few general updates. What I would like to do now in the packet that's posted on the agenda, the public can also see the information we've submitted, but Jocelyn is going to walk through the data that we did a deep dive on this last week. I'll talk a little bit about the options, and Dr. Pat will finish up with our recommendations. So Jocelyn, I'm going to move to your first slide.
Thank you. Thank you, Chair Buck and Commissioners. I am very pleased to be here today to be able to talk a little bit more about what we're seeing in the last few weeks here in Lane County. I know you are well familiar with our data dashboard, so for those people who are following along online as well, this is a graphic representation of pretty much the course of COVID-19 in our community since the beginning. And as you can see from this, and as we have said in the past, our community did pretty well and has done very well compared especially to other larger counties in Oregon for a long time, but it appears that that's changing now. So one thing to point out is, as you remember, we had a bit of a spike after graduation, a little bit at the end of June toward the early July, and then trended down again, and we were doing quite well again for a while. In mid-September, as you can see there, we started to see this increase, and that's what brings us here today. It is a sustained now increase, and we're concerned that we are seeing not just spikes, but something that has tipped more into more widespread infection in our community. So that is definitely of concern. I want to note too that this data reflect the date of onset for disease. So those dates don't necessarily map specifically onto our lab report data. So you'll see that as well going forward. They're just slightly different sometimes. Okay, next slide, please. I think another really important piece of this puzzle for us is we have talked about where are the infections mostly occurring. So this map helps us understand, and I want to point out too that this does not represent the total cases. If you see the button up there on the right, this says 517 cases. That's for the last 2 weeks. So that's the time frame that we're looking at here. It's not the total number of cases. So what we do see is there is, of course, the highest number of infections in the Eugene-Springfield metro area. It's certainly concentrated there, but it's not exclusively there. We also see outbreaks and large numbers in the Cottage Grove area, in the Thurston area, and East Springfield, also over into Veneta to the west in West Eugene, as well as Junction City. So it is not necessarily spread evenly, of course, across the whole county, but it is not solely concentrated within the Eugene-Springfield metro area either. Next slide, please. So this is data that are not available on our website. We were doing a little bit of a deeper dive into age groups specifically to determine whether or not there are concentrations among specific age groups. We've heard a lot about college age, of course. So what we have on our website are by decades. So we have 0 to 10, 11 to 20, 21 to 30. This is a little bit different. We developed these age groups to describe sort of broad life course stages. So we have 0 to 17, child, young adult at the 18 to 27 age range, and that encompasses, of course, our college age students. 28 to 65 is more adult age. It's a wide interval. I understand that as well. But it looks actually, if you break it down by, say, 28 to 44 and then 45 to 65, you'll see a very similar increase on slope. And then also this 66 and over. And as you'll see from this graph, those age groups on either end of the life course spectrum, 0 to 17 and 66 plus, those are, a lower number of cases, despite the outbreaks that we've had in long-term care facilities, which are not insignificant. We may actually be seeing a bump going forward in that higher age group as we see a growing number of cases among that age group. We do see the largest spike among our 18 to 27-year-olds, and that's certainly true. But I do think it's significant too that it's not them alone. So we do see quite a few cases among that adult age group too. So that's, I think, significant for our messaging. It's significant for our interventions. We know that this is becoming more broadly spread, and we need to consider focusing not just on one group, one age group, or even one area, geographic area, as we just noted. This is becoming more widespread in our community, and why it is of such great concern to us here in Lane County and here in public health. Okay, next slide, Karen. I think the other thing that, of course, gives us pause is the number of outbreaks we're seeing now. And it's not in a single place or among a single group. This, you could see from this outbreak graph that we have outbreaks in a wide number of areas, of course, and you'll have heard Jason Davis mention this a lot in our media press conferences, that multi-household social events and gatherings are by far the largest number of outbreaks that we're seeing. So it does feel like it could be that people are generally in many places maintaining good practices. They are wearing masks, they're practicing hand hygiene, doing social distancing. I think we see that out in the community when we're out and most of us are observing in our areas. But people tend to let down their guard with their friends, with their family, especially those groups that are not necessarily their household. They may see only occasionally, but they're not maintaining that same level of rigor when it comes to these practices. And that's definitely of concern. And we understand that because everyone is tired and there's been a lot of isolation over the last long 7-8 months, and it's hard to maintain. But what we're trying to emphasize is that it's never been more important than it is right now. And I think we're also noticing as well that there are quite a lot of workplace outbreaks. You'll see that's the number 2 category. And we will be probably announcing some other workplace outbreaks going forward as the number of cases begins to increase. We see sometimes that in those workplaces, it's not always clear how the cases are connected. Sometimes it's not necessarily within the work site itself. It could be that staff or employees are gathering outside of the workplace, and that's not uncommon. Sometimes we do see, of course, common break rooms or areas that people do gather within the work site. So for those employers and businesses where that's occurring, we're providing a lot of guidance around how to create the safest spaces possible within the work site. But we also need to carry this idea forward too, that people who are working together also need to maintain that same level of precaution outside of the workplace if they're gathering outside of business hours. And then I just want to note that there's a wide number of other outbreak areas that we're seeing here. So that's really, really important, is the diversity of outbreaks. Grocery stores, agricultural, Greek houses, the prison halfway house, restaurants, prison and jail, daycare. We have a number of daycares that are being identified, and that continues as well. And then, of course, some of these are related. You have people in a business outbreak that then also have kids at a daycare, for example. So we're seeing that as well. And that also goes to the kind of widespread nature of this infection in our community now, and why we're at something of a tipping point. And now we'll turn it back over to Karen. She's going to talk more about the policy options that are available to us.
Excellent. Thank you, Jocelyn. And I want to go through these relatively quickly so that Dr. Ludke can talk through why it is we landed where we landed in terms of options, and have plenty of time for discussion with the board. Some of these I think are going to seem familiar as we talk through. So option number 1 is really to lean heavy into our strategy around messaging. And for all of the reasons that I talked about in the opening, what we need people to do is really actually pretty simple and straightforward, right? Wear a mask, don't gather, keep your physical distance and hygiene. So it's not that we have a lot of technical expertise we're trying to do. It really is driving that behavior change so that people are willing to do these 4 simple things that we know will actually contain the spread of disease. So this particular strategy is around intensifying that message and continuing to lean into partnerships to help promote that. The second option is sector-specific work. And again, this is the piece of partnering with our business community in particular, and all of the sectors that make up business, but also looking at farm worker communities, specific neighborhoods, and geographic areas. And that was part of the discussion we had with city managers yesterday, in really looking at how do we do a deeper dive into those networks to really have the ability to make a difference. I will tell you that we are currently working with community-based organizations, CBOs, to address farm worker communities, to do bilingual and bicultural strategies to make a difference in those communities. We've convened our business partners, and with additional resources, I think can do even more of that targeted work to shape messages. The third option that we considered is one that came up at the last board meeting and has been raised at prior board meetings as well. Is there a gap in terms of guidance or ordinances that we believe the board should adopt? The example that was brought up most recently was to create a local ordinance that would require mask wearing. And to that particular option, as you know from doing many ordinances as a board, would involve at least 2 readings, separate readings, and a public hearing with at least a 2-week spread in between those. So that certainly is not something you could do today, but you could direct staff to bring that back if you chose to do that. And then, and I will just on that particular mask example point out that there is currently policy in the state of Oregon that requires masks be worn. That is part of the governor's existing guidance statewide. So I haven't necessarily heard that that would be different requirements, but it would be a local ordinance instead of the statewide requirement. Number 4 is this question of the governor's watch list. And as I mentioned, Benton County has most recently been added to the governor's watch list. The way the governor has organized her watch list is it's focused on sporadic case rates. So it doesn't take into account the other data that we look at on our alert list. So in the event that we were to have a sporadic case rate in excess of 50 per 100,000 in the last 2 weeks, and more than 5 sporadic cases in that period, then the governor would move us onto the watch list. The reality is we have not had an issue with sporadic cases. We, as Jocelyn said, we're able to do really great work in our contact tracing and link those cases up to outbreaks. So that is why we currently are not on the governor's watch list. And then finally, the 5th option that, and we talked about this a little bit at the meeting last week, was, does it make sense to return to phase 1? And as the board knows, there is existing statewide guidance that applies regardless of phase. And then there are some different guidance depending on whether you are at phase 1 or phase 2. When I looked at the state website this weekend, it looks like there are 4 counties in Oregon that are still in phase 1, Clackamas, Malheur, Multnomah, and Washington. And then the rest of the counties, like Lane County, are in phase 2. I will tell you there is not a clear process from the state about what that would look like. In trying to evaluate each of these options, we have inquired of what would that process look like, and we're still waiting to hear more details on that. And I know Commissioner Buck was part of a conversation as well. In the packet, I've outlined in general what the differences are between phase 1 and phase 2. I will remind the public that even in phase 2, there are significant restrictions around sizes of gatherings. We're still capped at making sure that indoors we aren't exceeding 10 people in a social gathering. So that guidance exists in phase 2, as well as a strong recommendation for employers to have people work remotely as much as possible. So those were the 5 possible options that we evaluated, and I'm gonna have Pat talk through why it is we landed on the 2 that we're recommending for you today. And I don't want to lose track of the fact that there also were questions about labs in the public comment. So when Pat finishes this, he's our lab expert too, so maybe he can respond to some of those questions. So Pat, I'll turn it over to you.
Thanks, Karen. So I'm going to take those 5 in reverse order and general sense of why we settled on the 2 recommendations that we did. So starting with the 5th one, return to phase 1. First of all, it's a very blunt instrument. It doesn't take into account the geography of our county, the frontier, rural, urban, and what Jocelyn went over in terms of where the predominant cases are. And that blunt instrument, it's blunt in a way that may not give us the maximum benefit that we would like, and may also put some punishment on those areas that haven't seen a great deal of disease. In addition, really, our residents have in many ways already voiced and are practicing their desires in terms of relative opening in our communities. And I think many of us, when we look across Oregon and across other states, question the ability to go back to phase one or full lockdown with fidelity. We think it would be quite a challenge. Number four, to be placed on the watch list, the one benefit of that would be that it would certainly send a message that this is a pregnant time of significant risk, and we really need to be careful, and that would be a benefit, sending a message. But Lane County has a robust case investigation contact tracing team. We have never bumped up against the governor's requirements for sporadic cases being at 50 or above. And it doesn't seem as though we will anytime soon, as long as we keep our numbers at this relatively high level and don't go too much higher, and we maintain the staffing that we have. In addition, if we were to move to a watch list, there are limited additional benefits or resources coming from the Oregon Health Authority. We already have a good relationship with them. We would not all of a sudden get more money. We wouldn't get more staff from them. So there's really very limited benefit in moving to the watch list. Regarding number three, as Karen mentioned, we already have a governor's mandate for masks, which really brings up the issue is around enforcement. If we already have that mandate, are people following the mandate? And if they're not, how could we move forward with enforcement? Having a local ordinance that says mask is required, again, might send a message saying that we are, again, in a risky time, and might reinforce the governor's mandate that currently exists, but it really doesn't change behavior on the ground, and it doesn't include enforcement. So I think those three would have a limited benefit moving forward. So next slide, Karen, if you would. The two that then we settle on are numbers 1 and 2, to continue to monitor and intensify the messaging efforts regarding our existing recommendations, and do so in a more robust and meaningful manner, trying to reach those who are not reached and trying to reach those already reached more times. And then look at the sector specific. As Jocelyn showed, we do have a deeper level of data in certain areas showing the number of outbreaks in certain sites. So around businesses, we know that there are impacts in restaurants and daycares. We know a few clinics have had some outbreaks. We know we've seen them in grocery stores. We can do some focused, more surgical precision messaging to those specific work sectors and address the data that we are seeing through our epidemiological evaluation in a more focused and direct manner. So those are our two recommendations. Chair Buck, I will now pitch it back to you.
Well, thank you all for your presentation. We are bumping up to a 10 a.m. time certain slot that we had. So what we'll need to do is pause. I think we got most of the presentation, if not all the presentation, out of the way, and commissioners can consider the recommendations and options, and we will come back to this and after we finish our 10 a.m. time certain meeting. I'm sorry for the interruption. So we will pause on item 5A and we will move to item 6A, which is order 20-10-06-01 in the matter of adjusting the base annual salaries of Lane County's elected officials. With us is Herb Voldman, Lane County Budget Committee Chair, Joshua Bernstein, Elected Officials Compensation Board, and Darcy Dillon, Lane County Human Resources. And I see also on the screen, Alana Holmes, our Human Resources Director.
Thank you, Chair Buck, Commissioners. Hi, my name is Alana Holmes, Chief Human Resources Officer here at Lane County. The purpose of our time with you today is based on our charge under the Lane Manual of 3.705, which sets the scope of the Elected Officials Compensation Board to recommend to the Budget Committee and to the Board of County Commissioners a compensation schedule for county elected officials. Today, Lane Budget Committee Chair Herb Voldman And the EOCB Chair, Joshua Bernstein, as well as Darcy Dillon, our Senior Workforce Analyst, are here to present the recommendations for compensation changes for the elected officials at Lane County. At this time, I'll turn it over to Josh, and you can begin the presentation. Thank you.
Hi, everyone. Josh Bernstein. Nod that you can hear me. Okay, good. More than one person. Thank you. I'm having some connectivity problems here, and I'm trying to share my webcam, and it's not working. So I'm going to try to, unfortunately, stop sharing it. Maybe it'll pop up. Anyway, can't see me. At least you me. That's probably better anyway. Just a quick introduction on who we are as the Elected Official Compensation Board. Our 5-member board made up of HR professionals. Currently, we have 4 people on the board. Myself, this year, I also serve as HR manager at Lane Council of Governments, and I always mention that obviously the board is, or Lane County is a member of our LCOG board, and one of the serves on the LCOG board, but my work in this regard is not connected to that and does not affect my work on the board. But I always just want to make that disclosure. In addition, we have Sherry Ballard, Vice President of HR for the UO Foundation, Penelope or Penny Doherty, who is retired Director of AA and EO Affirmative Action and Equal Opportunity at the U of O, and Lauren Perry, who is the Vice President of HR for Jerry's Home Improvement. Going forward, we're going to have 2 vacancies as Lauren will be resigning from that, and I trust that HR staff at the county, working with the commissioners, will help fill us out, our committee for next year, year after, etc. We held 3 public meetings over the summer, Zoom meetings or good meetings, of course, virtual meetings, to study and deliberate compensation for the elected officials of the county. Those were July 9th, July 23rd, and July 30th. We presented our recommendations to the Lane Budget Committee on August 24th. So if those of you who are commissioners are part of the Budget Committee and heard our presentation at that point, along with the Lane map, and so I'm not going to go into all the detail that I did at that. But basically what our considerations was that we were trying to make recommendations that would assist the county or assist the Board of Commissioners and county generally to maintain equitable, competitive, and a competent workforce. And again, the thinking is that these are only the elected positions, so still that we want to attract people and retain to those positions. Obviously, this year issues with the pandemic, the assumption that there would be some revenue loss from the county. We got that in our and I'll get that in a minute. Our goal was to use the same methodology for positions, and what that included was to match to the overall full compensation of market comparators. And there are 5 counties that we consider market comparators for that purpose: Clackamas County, Deschutes County, Jackson, Marion County, and Washington County. And we have those 5. Sometimes there's an out, obviously, with Clackamas and Washington being in the Portland metro area. Sometimes compensation is a bit higher. Deschutes and Jackson tends to be popular closest to Marion County. Been a good the last years, at least that I'm on this board, a good comparators. We also, in addition to looking external, in our world, we often will look at factors or internal equity, as we call it. And the thinking there that positions, even though these are elected, obviously oversee staff people, and that things among, in that regard, among internal staff. If you'd like to come up there, I know we've talked about salary compression. I know that for example, sheriff must make more, sheriff's number 2 person. There's not a law for the other elected positions, but we also looked at that issue, salary compression. We did provide the budget committee with several options and alternatives for salary adjustments. You might recall we gave 3 options. And again, I won't go into all the details, but the one or most expensive, if you will, option was the one that we really supported most, which was to basically everyone trued up, if you will, to what we thought the compensation should be at. At the beginning, the elected positions, as I'm sure you all know, but for anyone in the public listening, are the county commissioners themselves, the assessor, the district attorney, the justice of the peace, and the sheriff. So those are positions, and all those have one person in them, except obviously county, because there's 5. We did put some other alternatives that would be less drastic changes. We did also offer a year 1 and year 2 scenarios for positions that we were recommending. And also, given the right now expenses and resources, perhaps Board of Counselors, you could look at our recommendation 1 and 2 and then kind of figure out the increases would be better for year 1 or 2 as opposed to what we had to sort of look at it as a 2-year situation. One more, we look at compensation, which includes salary, but also a number of other things, typical things like benefits, and then unusual things sometimes in certain positions. There could be a car, or telephone, things like that. But so we look at what's called total comp in the HR world. The adjustments were to base salary because a lot of the total comp comes off of that. So anyway, as you know, we did make the presentation to the Budget Committee on August 24. The Budget Committee, as you know, looking at how the financial situation is, decided not to move forward to this board here today, any of those 3, but rather no increases to base salary at all for all elected positions. And I'll let her talk about that in a second. Again, as the committee chair, our committee feels strongly that for those of you who are elected in money, that we do think the positions should be trued up, that should be increased. But obviously, we understand the world of what's going on now, and in fact, whatever decision you as the board make on this issue. With that said, I will turn it back to Darcy unless there are any questions from me.
Doesn't look like there's any questions. This is Darcy Dillon. Thank you, commissioners.
And Darcy, I'm sorry to interrupt, but I do have a question when it's time.
I'll put you in the queue once the presentation is complete.
Okay.
Go ahead, Darcy.
All right. Sure. So real briefly, the recommendations that Joshua Burstein is referring to are included in attachment 2 in the materials. That's all of the recommendations that the Elected Officials Compensation Board presented to the Budget Committee. I have one follow-up to an issue that was brought forward at the Budget Committee having to do with the frequency of meetings and recommendations for the Elected Officials Compensation Board. So we clarified that the Oregon Revised Statute 204.112 requires the Elected Officials Compensation Board to annually recommend a compensation schedule for elective officers and to annually review compensation paid to persons comparably employed. So we thought it was very important that you knew that as you're considering your options. Do you have any questions about that? And we also have Steve Dingle on the line in case there needs to be some legal clarification.
Let's hold our questions.
I have a question.
At the end.
I have a question.
Okay, so
I would like the full presentation to occur, and then I have Commissioner Sorensen in the queue.
very good. So at this time, I'll turn this over to Herb Blodman to convey the information from the Budget Committee themselves.
Yes, thank you for this opportunity to present today. As noted, the Lane County Budget Committee met on August 24th and reviewed the full presentation from the Elected Officials Compensation Board. Following that, we deliberated as a group and developed our formal recommendations. As a summary of the committee's discussion, there was an acknowledgement of the economic hardship caused by the COVID-19 pandemic on Lane County residents, including the loss of jobs and the damages to small businesses. And as a quick note, the Budget Committee was obviously held before the holiday farm fire in Lane County, but looking back at our meeting notes, I don't believe that event would alter the committee's recommendations as they were made on August 24th. There was a balancing of factors presented by the EOCB. Primarily, these related to the non-commissioner positions of assessor, district attorney, sheriff, and justice of the peace. For these officers, or for these elected officials, pardon me, there was discussion on the portability of their skill sets to other jobs outside of Lane County and the risk of low salaries on that. Also, the importance of keeping good individuals in these critical roles, and the equity with COLA increases that were negotiated with other groups within Lane County. Reviewing the Budget Committee's process, I think we felt that giving weight to the current hardships facing Lane County residents was important, and that our recommendations are not a reflection on the individual value of individual elected officials in Lane County. Taking all information into consideration, the Lane County Budget Committee recommends no increases to base salaries of all elected positions for the calendar years 2021 and 2022. And we ask the Board of Commissioners to approve the recommendations of the Budget Committee. Are there any questions?
Is that the end of the whole presentation?
I believe
okay. So. I'll go to Commissioner Sorensen.
Thank you. I appreciate the opportunity to ask questions, and I'm sorry if I blurted in when I heard Mr. Bernstein say, are there any questions? So sorry about that. At any rate, my question goes to the process of the Elected Officials Compensation Board. And in particular, I think Ms. Dillon was talking about this, and that the Elected Officials Compensation Board will be meeting annually. Is that correct, first of all?
Based on our understanding of the ORS, we will have to have some sort of a deliberation on an annual basis to make a recommendation to the Budget Committee.
Will you be doing that during the budget process, or will you be doing it after the budget process as was done this year?
I need to talk to the Elected Officials Compensation Board chair and members to see if we can align it with the Budget Committee meetings. I think that might be the desire, but this was fairly new information, so we haven't had a chance to work out those details and what makes the most sense given the budget cycle and all of that. We do have a requirement to meet before July 31st of the year of a general election. That's in the Lane manual, but other than that, we don't have any current process in place to meet annually.
Thank you. And I appreciate all the work of the members of the Elected Officials Compensation Board. I'm planning on voting for the recommendation, but I think that Mr. Vlodman spoke for a lot of us on the Budget Committee when he said that our vote to maintain the current salaries and not raise salaries in light of the hardships going on in the county and the relatively good compensation that the elected officials are already receiving. It seems to me that this is a good decision considering everything that the Elected Officials Compensation Board had before it, which I know policy issues aren't really part of their work, but really the statistical work that they do. But the Budget Committee certainly was well informed about the hardships the community was going through because of COVID. And now, although this wasn't present at the time, but we now know that the county specifically has been hit hard with the fire and the resulting emergencies that have been declared. So anyway, thank you very much for your work. Bye-bye.
Commissioner Farr.
Thank you, Chair Buck, and particularly to you, Herb. Thank you for your ongoing work with the Budget Committee and your leadership this year throughout the entire budget process. Thanks from my heart. I have a quick question for you, Herb, or Alana, or Darcy. It's regarding the COLAs for the elected officials. Both the assessor and Justice of Peace are being recommended a 2% COLA at the first pay period after 1/1. Whereas the district attorney and the sheriff are being is recommended 1%. So 2% for two of the officials, 1% for the other two. Why the difference?
I think Josh Burstein, if you're still on the phone, you could probably speak to that.
Sure, I'm happy to. Still here. Basically, this goes back to what I said about the truing up, if you will. We thought that there were some positions that needed a greater increase in year one immediately because they had fallen so far behind. And so then when we looked at that with year one, when we got to year two, we looked more at the question of the 2% issue because those were what the staff and unions were getting. And so we kind of were looking at a combined tier increase. And we felt that if year one made up for most people, most positions, that year two then would be appropriate 1 or 2%. It wasn't as much it's not quantifiable as much in math-wise as much as we sort of trued up first and then kind of what would be right after that.
Thank you, Josh. By the way, I don't worry about not being able to see you because I'm looking at your Facebook page on my right-hand side here, and I know exactly what you look like. So thanks for that.
I'm sorry about that.
I'm not really looking at your Facebook page, but that doesn't really fully answer my question. It seems a little bit more even more arbitrary with that response regarding the COLA after the initial base salary increase of being either 1% or 2%. And I'd feel more comfortable if it was uniform at 2%. To include the district attorney and the sheriff at the 2%, the same as the assessor and the justice of peace. Thank you.
I may going to help a little bit from our conversations on the board.
Any other questions or comments?
So,
I'll do Commissioner Burney and then Ms. Dillon.
Thank you. I would thank you for the work of this group. I appreciate that. Before I became a commissioner, I made it very clear I didn't think commissioners should have pay raises after receiving a couple prior to. I remember vividly some gentleman wrote a letter to the editor in the Guard saying that Lane County commissioners should make $200,000 or $300,000 a year, and perhaps Bernie, doesn't really, he's not worth that, so maybe he shouldn't be a commissioner. That precedes this. I personally believe that were it not for the terrible tragedies affecting our community, I would have voted no on a pay raise for commissioners. My rationale for that would have been the delta between the average pay people in my district receive, families in my district receive, families in Lane County receive, and what's being recommended. I don't believe people run to be commissioner on the basis of market comparables. I don't believe that should be the reason people run to be Lane County commissioners. I don't think we get paid just because we've been hit with a variety of natural and, in some cases, human-made disasters. We just have to deal with it. I think that there is a disconnect between the people we represent and ourselves to spend this much time on it. I think that we interrupted. We've gone through this several times, and in fact, if I may, Joshua, just for the public to know, what was the amount you recommended commissioners should be making? Just the number.
Hold on, I have to find that. It was insignificant. Darcy, do you have Commissioner Burnett?
I recollect it was an
Yeah,
additional
so
10 to
the
13,000. Yeah. I'm sorry.
Correct. So the first option, which was to match the total comp, would have increased in year one $18,677 a year for a new base salary of $106,546.
Thank you very much, Darcy. So the public knows, at that meeting, every member of this Board of Commissioners voted to, we appreciated that, but voted to reject it. We just wanted to serve the people. Thank you very much.
Ms. Dillon, did you have another comment to add?
Yes, going back to Commissioner Farr's question about the percent of COLA recommended in the second year and why there was a difference between the different positions. So the elected officials compensation board, the base premise was to match the 1% COLA of the non-represented employees that was awarded for January 1st of 2021. Looking at the individual positions like the assessor, a 1% COLA would not maintain the equity or the difference between that position and the highest paid subordinate of that position, which was about 2%. So in order to try to have some difference between those two salaries, we had to do at least a 2% COLA in the second year. And then for the justice of the peace, we had difficulty matching this position with the comparators. And so we went with a straight 2% on the first year and felt that in order to at least maintain that same level of increase, we went with 2%. Additionally, I believe that it was Marion County that we're almost 2% off from their base salary. And so they were I believe the lowest paid county comparator that we were using.
Thank you for that explanation. That covers it in detail, and I withdraw my recommendations for equity in those, or equality, excuse me, in those four positions. Thank you, Darcy.
Any other comments or questions? Commissioner Bozovich.
This is Josh Bernstein. A comment?
Josh,
What was that?
let Josh finish his comment.
Okay.
Oh, thanks, sir. I appreciate that. Sorry, I'm not hand if I'm not on my video working. I just want two things. One is thank you and other staff responding to Kafar's question. That was a more complete answer than I had given a few minutes ago, and I do recall that from our conversations now. So I really appreciate the work and help that staff has given us. And then just one note what Commissioner Burney said. The numbers that we came up with were high. We tried to soften it by having three options. I know you all know this. This is more for the public. Option two was to match within 5%, because within the HR world, plus or minus 10 is what's seen as kind of within the realm. comparator-wise. And then option 3 we even gave was to be at 5% below the lowest of the 5 comparators. Those numbers were still very high. Even that option 3, the lowest option we had come up with, was an increase of $8,000. And so I fully agree with what Commissioner Burney and the rest of you are saying on this board. I just wanted to kind of explain a little bit more for the public, again, that our role as the board, as HR professionals, was to look at completion, comparators, equity, all the things I mentioned before. We are just an advisory board, and obviously suggested to the budget committee, which in turn suggested to you what to do. And so I really appreciate the opportunity for all of us on our elected officials compensation board to the work we did. I do know that all of you, as you've said, respect our work, even if in this case you strongly disagree with our recommendations. That's perfectly fine. I just wanted to explain a little bit about where we came from. So I hope that helps a little bit for people who's much of what we are explaining where we came up with. Thank you.
Thank you, sir.
Thank you. Commissioner Bozovich.
Thank you. So, like Commissioner Burney, I chose to become a county commissioner to serve, not to earn a high salary. I took a 25% pay cut the day I got sworn in. And in addition to that, I took a significant cut in my future retirement throughout the rest of my life. So I fully support not giving commissioners pay raises at this time during COVID. And I have been consistent in voting against pay raises throughout my tenure as a commissioner. I am concerned, though, about the other elected officials' positions. And I expressed this during the budget committee, although I'll support the recommendations that came out of the budget committee for no changes in our compensation at this time. But the other elected officials' positions are not purely elected to serve as representatives of the citizenry. They're skilled positions that are transportable skills. And we really need folks there that are skilled. The sheriff could easily become the chief of police for a municipality. And I kind of wonder what the salary is for the Eugene or Springfield chief of police is compared to his salary. Not just what other sheriffs are. You know, the DA could work in the U.S. Attorney's office or, the state Attorney General's office or any other district attorney's office, and is basically running a large law firm. So, when you talk about some of these skills these people have and how transportable they are in and out of the private sector too. Because I tell you, our assessors' skills would, transfer very well to private sector. And I'm sure he could find a well-paying job there. So I'm a little concerned that we're leaving those alone at this time. But I think at this time in the middle of COVID and with everything else going on, I'm going to support the motion. I definitely would not have supported any sort of increase for the commissioners at this time. So I just want to express that before we get to a motion to vote, unless the chair is ready for a motion.
I would like to make a comment first, and then I think we will be ready. I was fairly vocal about my position that I did not feel that any electeds should be getting a raise at this particular time, especially during COVID, now wildfire. And I know that we didn't all agree on our budget committee board. The majority prevailed for this recommendation. I still feel strongly that this is the right recommendation at our time at the county right now. I do want to also give my appreciation to everybody who put in the effort to be on the board and to take the time to discuss it each year. I do have a technical question for Ms. Holmes. We have one board order on the agenda item, but within the material, we have several orders. So I just want to clarify if we make a motion to approve the order as stated on the agenda, that it wraps up all those board orders into one.
Chair, Commissioners, thank you for raising that question. I'm looking at Darcy on the screen because I know originally from past conversations, the ask had been to have multiple board orders. Darcy, was it because of the recommendation of the Budget Committee that it was a unanimous, that the recommendations we knew coming forward, you decided to roll it into one board order?
I actually submitted separate board orders for each position based on the direction of the Board of Commissioners in 2018 they requested from that point forward to always bring separate board orders for each position because there might be conflicts of interest from commissioners, and they didn't want to have to, at that moment in a particular board meeting, try to edit board orders to pull out different positions. So the materials I submitted, there were a separate board order for each position. So I think I'm going to have to defer this question maybe to legal, or as far as if you make a motion, does it cover all of them? I'm unclear about that.
And Darcy, thank you. As I'm looking through the board packet, I see multiple board orders that were attached, which I had recalled you had, planned on doing.
Could we make a motion to wrap it all into one board order and put it on consent calendar for our next meeting?
This is Steve Dingle. You can do.
In that case, I suggest we do that.
Go ahead, Mr. Dingle. I did not actually hear what you said.
Chair Buck, I said that you can do what you're suggesting, which is wrap it all together and bring it back on the consent calendar next week.
Okay, sorry, Commissioner Burney, go ahead.
Chair Buck, this is Diana. Can I interject for one moment?
No, you may not.
Sorry, Commissioner Burney.
Yes, you may.
I just want to confirm with legal, all of these board orders have the exact same title. And we will need to bring them back on consent, and I will need to assign board order numbers to them. Mr. Dingle, so the motion will just be to bring them back on consent?
I guess I'm not understanding the question. I understood the suggestion to be based on the conversation today that those would all be, whatever's in each one of those orders would be consolidated into one order and brought back for approval on the consent calendar next week. Is that not, am I misunderstanding?
I think they are multiple orders, all with the same exact title.
So,
okay, I'm sorry. I thought that, I understand that. I guess I don't understand. I thought the suggestion by the chair was that Ms. Dillon go back, consolidate however many of those orders are into one single order and bring it back for approval of the on the consent calendar next week.
Yeah.
Okay, Commissioner Burney.
Well, now that we've clarified that, I was saying, Chair, before you didn't hear what Mr. Dingle first said, and I did, I was simply going to suggest, and I can even make this in a motion if necessary, I move that this entire item be formulated as appropriate, consistent with this board discussion, and brought back on the consent calendar at our next board meeting.
I second the motion.
Okay. All right, motion presented by Commissioner Burney, second by Commissioner Sorensen. Is there any discussion? I have one question for Mr. Dingle. Is that motion sufficient?
I think with the explanation that's happened that it is. And just to be clear, there'll be one order where all these other orders will be rolled in.
Very good. Any other discussion? All right, I'll call for a vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you very much. We're going to roll back to item 5A. We had our initial presentation regarding our COVID-19 response and recovery. And so now it is time for comments and questions by commissioners. Some people have frozen on my screen, so I can't tell if everybody's here. Commissioner Farr.
Just very briefly, a fantastic presentation, gave me a lot of talking points that I typed down as quotes from each of the officials who presented, so thank you very much. One clause stood out, Ms. Gaffney, you said it over and over again, and it seems that the staff recommendations are centered on behavior change and getting the message out consistently that people's behavior should change in order for us to curb the rising tide of infection in Lane County. You know, we're talking about messaging from your IT department, your public PI department, regarding getting the message out. And you mentioned upward of 2 million message receipts per week that are being generated right now. And really, a simple, clear, concise message repeated over and over again is what really works. And you know that. I know that Jason knows it. I know that media professionals all know it. And a question that I have, a really simple one, is how does an 8,000 square foot hardware store in Bethel compete with Home Depot and ultimately beat them in the marketplace? Well, the exact same method that we need to use and that you are using regarding COVID, a simple, clear, concise message that everybody understands because it's put out in terms they understand. I appreciate that, Karen, and I appreciate the work that you do, and I appreciate the recommendations that you're making, and I'm in support of the recommendations. Thank you.
Any other questions or comments by commissioners? Commissioner Burney.
I don't know is it possible to put the recommendations on our screen as we're having this discussion or no?
It should be. We'll work on that. Diana has
Okay.
the slides, so it's probably easiest for her to just pop them up at this point.
Well, I'll cover for you with Gavin, just very briefly. My understanding is that you were mulling, you meaning the entire team, were mulling over the recommendation you were going to provide to the board for action. As initial baseline, I know you have not recommended, and personally, I'm glad that we go back to level 1. But had we, what would that have meant, Karen, concisely?
Thank you, Vice Chair Burney and Chair Buck. I'm sorry, I was distracted by trying to get the screen up. I'll answer your question briefly, and then certainly Jocelyn and Pat can weigh in as well. If we had successfully gone back to phase 1, and again, ultimately that would be the governor's decision, but we could request that. There are a couple key things that would change based on the tool that the governor's office has posted, and we have in our materials for the public as well. The sectors that would be most significantly impacted are indoor entertainment, outdoor recreation, sports, venues in general, and so in those venues, it's about how large a gathering happen. Does that make sense?
Yes, thank you. I'm going to just have a few comments interspersed. Another is, you mentioned earned media and paid media. My question is, what about donated media? public service announcements, things of that nature.
Thank you, Commissioner Burney. I would say our donated media is included in that category of paid media because typically it comes in the form of a match. And certainly the public service announcement is a great example. Dr. Ledke was over in KEZI Studios Friday morning filming a direct message. And so that's one where we have paid some for the production, and the television stations have donated significant airtime to run it.
Okay, what is significant airtime? How long is it? How many times is it going to go on the air? During what periods? Because that's going to define the audience. Over how many shows? I don't expect you to answer all this now, but I think that this is part of the strategy, because based on the two recommendations, which I personally applaud and will support, we could either screw it up or we could do it right, or we could be somewhere in between. And my sense is that we need to do it right, that this is an emergency, that it is profoundly affecting each of our lives in different ways. And so unless I'm seeing all the stations stepping up, including cable stations, and giving us time and getting those PSAs out, exactly as Commissioner Farr said, oftentimes leadership is saying the same thing over and over and over again. I just want to impress that. And then my last question relates to when Jocelyn was showing us this kind of where things were, it looked like, is there a relationship between the University of Oregon accepting their freshman class in and the kind of spread we're now seeing?
Jocelyn, do you want to talk about that?
I don't think we could say it's the freshman class. The testing that's been done as students are admitted back to campus.
Okay, I'm sorry. Yeah.
Yeah, very few cases. I think the total is 6 thus far. They will be retested. I think the fear really for campus is that now that students are back, and if there is intermingling more, among these groups, especially when we have higher rates of infectivity in the community, that campus could then certainly be at risk.
Well, according to a registered guard story I read, it's already happening. And my understanding is just this weekend, there was a gathering of 100 to 150 young people doing what I would have done at that age, getting together and having fun. And I think that that's a recipe for disaster. And as I recall, looking at your charts, social gatherings kind of related to the vast majority. I want to share that last night, parents and grandparents of children at Thurston Elementary School received a note and the note said that someone from that school community has come down with it. It did not tell us if it was a student, if it was a teacher, if it was a visitor. We have no idea. And that's my last question. And thank you, Chair. The transparency of data. Don't you think it would be helpful for us to have data a little more honed in to the specifics so communities could be on guard and take proper notice? And before you answer that, I just want to say, me personally, I don't know about you all, but I observe people wearing masks all over the place. I have seen a dramatic increase in exactly the kind of behaviors we are going to continue to promote. And as we promote them, I just think it's real important to say, this is how we keep our county open.
Mm-hmm.
That's all. Thank you.
Thank you, Commissioner.
If I could just give a quick response, and I don't know if Jocelyn wants to weigh in as well. In terms of, I appreciate the reference to the party in the newspaper, and that headline caught my eye as well. And then as I read through the story, it seems like there were very few University of Oregon students at that party. So I think when we talk about college age or young people, it really, in our minds, I think sometimes we connect it with the University of Oregon, but there are a whole host of young people who live in our community who actually aren't students at the University of Oregon, or certainly didn't come here.
100%. I'm sorry for the innuendo, but the fact remains there were 100 to 150 people there.
Yes, and that's the behavioral problem that we need to address. Absolutely. So I don't know, Jocelyn, were you going to talk a little bit more about that?
Well, yeah, actually, if I could just address the issue around the information that we release around cases. You mentioned in the Thurston area. When it comes to individual cases, we're very careful about personal health information and making sure we keep people's privacy to the extent possible. So the information that we share with schools and that schools share with us is really around maintaining that minimum amount necessary to ensure an effective investigation. So there could be someone in the community, and that doesn't mean that they were ever on campus or that exposure was ever there. I can assure you that our case investigators do investigate every case to identify close contacts. So that happens. If there was a concern around community exposure, we would announce that and make sure that that's well known. But to give more information than is strictly necessary, it would also potentially compromise the identity of cases. So we work very hard. That is a core principle of public health, is to maintain patient confidentiality, but it is a balancing act. So we do have agreements with schools and with businesses to disclose that information when it's necessary for the protection of public health.
Fair enough. Thank you very much. Makes sense. And thank you, Chair. And thank you for responding to my somewhat sporadic different points. Thank you.
Chair, this is Pete Sorensen.
Go ahead.
Thank you very much. At this time, I'd like to make a motion to pursue options 1, 2, 3, and 4. That is to continue to monitor and intensify messaging efforts regarding mass gatherings, distancing, and hygiene. The second one is sector-specific work, i.e. work with higher education, businesses, faith communities, etc. 3, direct staff to prepare an ordinance to require mask wearing. And 4, to request to be placed on the governor's watch list. So that's my motion.
Okay, a motion's on the floor. Is there a second? I don't see a second, so that motion fails. Commissioner Bozievich.
Thank you. I don't even, do we actually need a motion to direct staff to continue the 2 options that they're recommending, or is just go forth and do good work enough from us with the board? Chair and Karen, do you need a motion from the board?
Chair Buck and from my perspective, we do not.
Can somebody put on mute because I cannot understand?
I'm going to try that again. Chair Buck and Commissioner Bozievich, from my perspective, given the nature of these recommendations, it does not require board action for us to continue to pursue those.
Thank you for the clarification. Commissioner Bozievich, did you have
Yeah, well, a couple additional comments. I just want to say I really appreciate the work staff is doing. Our random case rate is so low, and even with our increase in tracking up over 500 people, you guys are doing amazing work. And what I've been trying to convey to my constituents out here is if we don't start changing behaviors, and I know there's a lot of fatigue, I think a lot, you guys identified it, people are just getting tired of being separated and not having events, and they let their guards down. They may not have washed, being as careful about hand washing and other things. And that's where we're starting to see some of this case rate climb. And my message to folks is we got to get those behaviors back in control so you guys can continue to do the contact tracing you've been doing. It keeps our random case rate down and keeps things, so we don't exceed our staff's capacity to contact trace and manage this outbreak. And I just want to say you guys are doing great work. And my message out to everyone I talk to is we have to support you by not overburdening you with additional cases. We have to to go back and remember to do the things we're supposed to be doing. And I specifically, made sure I didn't attend a couple events this weekend, that are related around, community events and also even, upcoming election stuff, just for that reason, to try and reinforce, even with my own behaviors, not adding to the number of people in my bubble. So I really appreciate that. At the same time, I want to make sure that we put this into perspective. Oregon has still got the 4th lowest case rate, including the District of Columbia and Puerto Rico, in the United States, at 824 cases per 100,000. Lane County is at half of that, at 412. So we're half of the 4th lowest state in Lane County, even with our recent increases. And as far as death rate goes, Oregon's the 6th lowest in the nation, including Puerto Rico and the District of Columbia, at 14 deaths per 100,000. Lane County's at about 5.3 deaths per 100,000. So, we're doing really well. The problem is we've flipped that a little bit, though. If you look at the state's average over the last week of new cases per 100,000, it was 47, and Lane County's at 69. So, just in the last week, we basically jumped past the state the last 2 weeks in new cases average. That needs to change. We need to get back to being one of the safest counties and one of the safest states in our nation. And folks need to pay attention, and we need to keep getting that message out. All of us board members need to continue to echo that message in the community, and hopefully we'll get this little surge of cases under control without having to do any further damage to the psychology of our community through isolation and to the economy of our community through restrictions on businesses. So I fully support the 2 options that staff has recommended.
Commissioner Farr.
Ever so briefly, Commissioner Bozievich said much of the words that I would say. Intensify messaging, Ms. Gaffney. That's kind of the main point of the recommendations. And I'm going to add something that Commissioner Berney said, and to be a part of the messaging. This is how we keep our county open.
Commissioner Berney.
Thank you, Commissioner Farr.
Sorry.
Commissioner Sorensen, I understand we were going to be able to see you at 10 a.m. Anyway.
I'll work on it.
I want to also thank Commissioner Bozievich. I really appreciate, Jay, what you said. And it does put it in, I think, a really good perspective. In fact, and Karen, I want to echo, sometimes I'll listen to a message and I'll get granular and I'll ask specific questions with the intent of improving. But truly, your staff and everyone in our community is to be absolutely commended, applauded, appreciated for helping keep us safe. It looks to me, as I was looking at some of the numbers, as I recall, when all this hit, a big issue had to do with capacity of hospitals, right? And capacities of respirators and PPE. Am I correct? And it looks as if we have less people hospitalized. So how is our capacity in that area doing?
Thank you, Chair Buck. Vice Chair Berney. It's an excellent question. As you remember, that's one of our indicators of serious disease, is how many people are in the hospital and are we taxing the resources there. We are in regular communication with all of the hospitals in the community, and they report that they have sufficient capacity at this point. We have kind of been hovering around the 10 or 11 people in the hospital, and that is at a manageable level for our healthcare system right now.
Thank you, Chair. Thank you, Karen.
Chair,
Yes, go ahead.
thank you so much. Well, first of all, here's the sad reality of our doubling. By June, we doubled our, spring rate. By July, we doubled our June rate. By September, we doubled our July rate. And so we hope that we will not be doubling our September rate. But in the meantime, I think that it would be helpful for staff to not only develop the masking infraction ordinance, but also to include the other major behavioral piece that we're looking to, obtain, and that is that we have social distancing. So as we are apparently not meeting next week, staff needs to keep a strong eye on whether these additional efforts that are being made that are in the memo as items 1 and 2 need to keep in mind that if we do get another doubling of the caseload, as we have been slowly doubling, if we do get that, then it seems to me that staff needs to come back with something as you've considered those other options, and work on not only a masking requirement to implement CDC guidelines for masking, but also to implement CDC guidelines for social distancing. I'm getting a lot of email from people saying that their neighbors are holding parties, that their neighbors are, creating traffic problems with the number of people at their homes, and they wonder what they're doing in there. And the first thing that comes to their mind is that they're violating what they think is an enforceable rule, i.e. CDC guidelines for masking. Apparently, it's really not enforceable. Nobody's enforcing it at all. And it seems to me that developing an ordinance for an infraction for both violating the CDC guidelines on masking and social distancing might help. And I would just say that I was pleased with the various options because staff is obviously trying to do the best they can given the apparent reluctance of the board to move ahead with some sort of enforceable standard. But I'll just hope that we do not get another doubling in caseload. And I also appreciate Dr. Warren's pointing out that the hospitalization rate is an indicator of the, of how bad the disease that's spreading in the community continues to spread. And last but not least, I would encourage all of us to be using phrases like the deadly COVID-19 rather than sort of minimizing the significance of this by saying something like COVID-19, when in fact it's still a deadly disease that's spreading in our own community. Thank you.
Thank you. Well, I'll add a couple of thoughts of my own. We've had several conversations about this over the week internally at the county level. I've been in discussions about this with the governor's office regarding what returning to phase 1 could actually look like from a process perspective. That clearly there's some confusion as to how to make going back to phase 1 and back to phase 2 happen. And I agree that tasks 1 and 2 are highly important, but frankly, we've been doing them and our numbers continue to rise. I would expect that we will be on a governor's watch list soon if our numbers continue to rise. We should be prepared to be on the governor's watch list soon if our numbers continue to rise. There's still additional options on the table if we can't get behavior to change in our community. And as I mentioned in the press conference last week, I don't mean those people change their behavior. Those people should change their behavior, as in those students or those people at the workplace or those people in the residences. This is about our individual responsibility to ourselves, our family, and our community. Everybody needs to participate. This is an us issue, not a they or them issue. So I strongly urge folks to continue to follow the guidelines so that we don't have to move on to options 3, 4, and 5. And option 4 may not be an option. It may be dictated to us. I hear from the commissioners in general that we support options 1 and 2, and we don't need a motion unless we decide on something more than what is recommended at this time. Ms. Gaffney, do you need anything more from us on this issue?
Chair Buck, thank you. No, that is the guidance that we were hoping to get today.
Thank you very much. We'll move on our agenda then to item 5B, which is a Holiday Farm fire update. And with us is our administrator, Mr. Mokrahysky, and Dan Hurley, our Public Works Director and Incident Command Leader for the recovery effort, if he's with us.
Thank you, Chair. And I think, Dan, are you with us?
I am.
Okay, there you are.
And I'll follow after you.
He's in the EOC with his mask on, demonstrating both great leadership on the fire response as well as on COVID health protocols. Thank you, Dan.
And making a fashion statement.
What's that?
And making a hell of a fashion statement.
That's right, yes. I mentioned this morning that we've moved from fire response to recovery, and now we're going to be moving into a really focused effort in the 4 areas that I referred to: housing, human services, debris management, and environment and watershed restoration. And so Dan will walk through, and Dan is leading this effort with a great team of folks, both internal to Lane County and partner organizations. There's a lot of collaboration between utilities and nonprofit organizations and state and federal agencies. And so Dan, I want to turn it over to you to walk through where we're at and where we're headed.
Okay, thanks, Steve. And good morning, commissioners. And I'll try to be brief. I know you're running long. There is a full report, a situation report that's in the board materials that was just posted on the website this morning. So if the public wants to get into more details of what actions have been taken around the fire, they could go to that source. But as Steve said, we're moving into recovery. We're out of the initial life safety issues around the emergency, removing hazards. We're still working on restoring utilities. The evacuations have been lifted, and the fire is getting close on containment. As of yesterday, the fire was 78% contained. We have displaced persons being housed in emergency shelter. Our number right now is 678 persons being sheltered by Red Cross in at least 18 hotels. We found out that just recently that we have 95 in Deschutes County that are in 3 hotels, and we're going to be doing some outreach to them. But we're moving now into the shorter term recovery with keeping an eye on the longer term recovery. And the focus of our short term recovery is making sure that people still have that emergency sheltering in place for the next coming months. We're not sure how long Red Cross will allow folks to be sheltered in hotels. Probably not, a year or 2 years that it may take to rebuild all the homes up in the valley. So we will need to be working on longer term sheltering options. The other piece is connecting people with resources, making sure that they have registered with FEMA and that they're getting the sheltering assistance that they are able to receive, as well as any unemployment assistance that they can get through FEMA. and addressing any sort of immediate environmental risks. And so those have been focused on removing the hazardous waste first, and then we'll be getting to the debris removal in the more longer term recovery. So to do this, both for the shorter and longer term recovery, we're planning to step up, they're already in place, task forces around housing, human services, debris, and watershed. And so for each of those 4 task forces, there are shorter and longer term tasks that we're working towards. With the housing, again, it's focusing short term with hotels and then looking at potentially emergency siting of RVs where people have them, where they're able to return to their properties. I think it's something we need to talk about with the RV piece with regard to fees. Perhaps this is something the board could take on today or at a later date. We will be returning with land management later in the month, but would like to offer reduced fees or waived fees around emergency siting of RVs. The fees on that can range from about $250 to over $1,000 based on the inspections that are needed to ensure that those RVs are connected properly to electricity and to a septic system if they're going to be there long term. Medium, we're looking at properties where we could set up trailers, potentially FEMA trailers if those are available. We're hearing mixed messages on that, or potentially purchasing some modular type buildings that could be set up. So we've identified 2 properties upriver and have submitted land use applications to be able to use those, and we're working through that process. And then longer term, looking at ways where we can assess the needs for rebuilding to make sure that we are rebuilding for resilience, that we're following applicable code, and that we're trying to expedite the rebuilding process up there where folks can rebuild. So that's going to be a longer term process. We are working with Land Management Division to adopt some new systems and processes and technologies, hopefully, to facilitate that effort. We've looked at some rebuilding that happened down in Santa Rosa, California, for example, that has provided some resources for folks that are trying to rebuild. But I think we need to acknowledge that this is going to be a long, slow process on the rebuilding. With the folks that we talked to from California, maybe Steve has the number, but there were only 11 homes that had been built over the span of 2 years. So hopefully we can move people faster than that. And I'm not sure what the delays were there, but people are definitely, feeling a rush to get back up there and rebuild. But the reality is there are going to be significant hurdles to clear all that debris, restore the infrastructure, particularly in areas, Blue River, where there wasn't a functioning municipal sewer system to start with. So could be a lot of damaged septic systems, those sort of things. Human services, again, making sure that people are getting the assistance that's out there, particularly through FEMA and through other agencies. For the last several Fridays, we've had MARCS, the Multi-Agency Resource Center. We had our last one last Friday. Now we're setting up what we're calling mini MARCS. We're co-locating these at the fairgrounds near where they were before, next to where FEMA has set up a 7-day-a-week external outreach center. So we have staff there that are connecting people to counseling, making sure they're signed up for assistance, those sorts of things. We're also going to be pushing out mobile MARCS. So we're hoping to go upriver every Friday at different locations to connect with people that are upriver. And then over the next couple of days, actually, our community service worker is heading out to Bend to connect with those 95 people that are on the other side of the burn area. Then moving to the task force around debris. Again, the short term is around hazardous waste and getting people to sign the right of entry form so that EP contractors through EPA and DEQ can get in there and remove that hazardous waste that poses a significant risk to the land and the river. Longer term, also through that right of entry process, we're trying to get folks to sign up for larger scale debris removal. We just received word yesterday that FEMA has authorized what they call Category A which would be reimbursement for up to 75% at this time for the cost of debris removal. So really trying to push this with the property owners there, that this will limit their costs for cleanup, because while their insurance would be billed, as we understand, because FEMA can't reimburse for costs that are already covered by insurance, that costs that go above that would be covered by this FEMA declaration. So it's a real benefit to have that as a coordinated effort under licensed contractors. And so that'll be a longer term effort that's going to happen through the winter, and we definitely have some environmental concerns about that. Which brings me to the last task force, which is around Watershed. Again, for the short term, focusing on hazardous materials and erosion control along the river. eWeb will be leading this task force, and they've identified about 60 properties along the river that we're going to be focusing on to try to get those right of entry forms, get the hazardous waste assessed, and do some soil stabilization measures there. Longer term, this is such a huge burn area. We're very concerned about landslides, debris flows all through this area and into the private forest land that could bring its way down to residences and the transportation corridor. So we'll be working with various partners. Again, eWeb is leading the debris task force. They've identified over 70 individuals as stakeholders to start pulling people together and identify resources and projects to move that watershed stabilization piece forward. So that's a quick summary of sort of the short-term efforts. And as we're looking towards the long-term, I think the board does want to think about, the extended long-term and what should be done there and how that should be organized and resourced. FEMA recommends naming a local disaster recovery manager and resourcing that to connect with nonprofits and doing all the community outreach that needs to happen as we try to rebuild the whole community. So those will be longer conversations. Again, we'll be back with land management towards the end of the month to talk about some of the issues around rebuilding and zoning. You have a conversation this afternoon around floodplain issues, but I'll stop there and try to answer any questions you might have at this time. Thanks.
Thank you. We are just a tad behind in our agenda today, so I'll ask if there are comments and questions, but if we could keep it moving, that would be great. Any comments, questions? Well, that's really brief. I just want to thank you, Tam, for all you're doing, and everybody that's in your room there at the EOC. They're doing a fantastic job. And I know that the people of the McKinsey appreciate all the hard work. You just have to keep one foot in front of the other going through recovery. It is extremely confusing for the residents. There's a lot of new stuff being navigated, and we are all trying to figure out the rules and regulations as well. I do appreciate the assistance of FEMA. I did meet with the FEMA administrator, Mr. Gaynor, over the weekend. With several of you and many others in the community and University of Oregon partnership, and know that they are a key partner. Sometimes navigating their system is a bit challenging. We will do it eventually. They have a very specific system that you must follow in order to get reimbursement. And it's just so very important that we make sure that we can get every piece of assistance to our community as we possibly can. All right, well, if there's no other comments or questions, we will continue moving along with our agenda. We'll move to item 7, which is our consent calendar. Is there a motion to approve?
So moved.
Second.
Moved by Commissioner Birdie, second by Commissioner Sorensen. Any discussion? All right. Not saying any? There is some feedback, so on me, that'd be great. All those in favor, please say aye. Aye.
Aye.
Aye.
Aye.
All those opposed, say nay. Motion passes unanimously. Thank you. County Council, do you have any announcements?
No, Chair, just that there's an executive session this afternoon.
All right, we'll go to item 9, County Administration. Item A, Order 20-10-06-03. In the matter of revising the 2019 through 2021 Community Corrections Grant and Aid budget and delegating authority to the Public Safety Coordinating Council planner to complete and submit the Community Corrections Biennial Plan Modification Forms, and to the County Administrator to amend intergovernmental agreements and contracts. And with us is Paul Solomon, Chair of the Public Safety Coordinating Council.
Thank you, Chair Buck. Commissioners, good morning. For the record, my name is Paul Solomon. Can everybody see and hear me this morning? Great. So we are here today. I'm actually here with Denise Walters, who has recently replaced Susan Sowards as the principal planner for the PSCC. And we're here today to make recommendations to the board to revise our grant and aid budget. The budget committee of the Public Safety Coordinating Council, chaired by Commissioner Bozovich, met on August 26th to make revisions to the grant and aid budget. We have been meeting roughly on a quarterly basis to take a look at where we are in our biannual spending, because we have so many different pieces in our grant and aid and justice reinvestment budgets. It's important for us to keep an eye on our trends there. And what we realized is that there were a couple areas where we were underspending. So if I can get you to refer to your board packet on page 3, it's actually listed as page 2, but it has a chart in there. You'll see that we are proposing to make a few recommendations. We are looking to reallocate funding from sex offender treatment and the RLAN support services. So sex offender treatment, as it turned out, we have a new provider that was contracted through parole and probation. They got a bit of a late start and their numbers have been significantly down. They're also operating using a new curriculum. So as a result, there's a recommendation to reduce their funding for the second year of the biennium by the amount of $146,639. The recommendation is to reallocate those funds to the 416 program for parole and probation to pay for part of a supervisor position, a probation officer, and a corrections tech. And these were positions that we had originally hoped to fund with additional funding from the state that never materialized. There was a lot of talk earlier in this budget cycle about additional grant and aid funds based on the time study that was done for parole and probation. Those dollars never came through. Parole and probation is still providing those positions. It's a very important program. So we're asking that those funds be allocated there. We're also reducing $45,830 from the RLAN program. This is a program that operates out of the Sheriff's Office in the Work Release Center in partnership with sponsors. And what happened there is the state turned off the spigot when COVID hit and we stopped receiving referrals. So we had fewer people to serve. We have since started that program back up this month and anticipate hopefully ramping up so that we're able to utilize the remaining funds for the rest of this budget cycle. But we would like to reallocate $45,830 to crisis funds, which are administered by sponsors to pay for bus passes, ID, things that parole officers make referrals for individuals who are indigent, and to pay for the Inmate Welfare Fund, which is a funding source that augments housing services at sponsors that was cut by the Department of Corrections for the second year of the biennium. This would make that program whole. So those are the funding recommendations. But I would also like to take a quick moment to bring up a couple of things. One is I want you to know that we have been spending some time, myself, Greg Rickoff, Denise Walters, and Mo Young, planning for future PSCC meetings to begin to address racial equity in our public safety system. We are at a unique moment in time, and I really believe it's incumbent upon those of us who work in public safety to begin to act. And we have all of the players at the table at the PSCC, I look forward to reporting back to you on how we progress in this work. But I think given some of the conversations that have happened recently, the listening sessions, the effort by the board, that we have a unique opportunity at the PSCC to engage in this work. Finally, I'd like to give a really brief update on some of our grants that are either pending or have been recently received that Denise Walters has been working on. Denise, are you able to give us a quick update? Okay, it sounds like she is not logged on. I will pause there and answer any questions at this time.
All right, any questions or comments? Commissioner Bozovich.
Thank you. I just want to make sure that the board's aware that normally these budget changes go through the full PSCC before they come to the board. This one's coming directly to the board because we had to cancel the PSCC meeting due to the Holiday Farm fire occupying almost all of our participants in the Public Safety Coordinating Council in other duties at the time. So it's coming directly to the board. It was sent to all the members of the Public Safety Coordinating Council as part of that agenda packet, so they've had an opportunity to see it. The Budget Committee does consist of some of the major people involved in the PSCC and people involved in these budget changes. So I do believe that there's really no objections to these changes, and I think they're beneficial to the continued work we're doing in justice reinvestment work and our continued work in the community. I think we're, doing some great work, and I really appreciate Paul and his leadership on the PSCC.
Chair Buck, I do have those grant updates in front of me if it would be appropriate now. So we have recently been awarded $316,084 from the Oregon Criminal Justice Commission for coronavirus emergency supplemental funding. And these were additional dollars that the CJC made available to counties by application that pay for a range of supports in the public safety system. So we're really excited to get those funds. It's being administered by the Sheriff's Office. We also have been awarded the Impacts Grant by the Criminal Justice Commission, which has been awarded to Lane County Health and Human Services to provide supports in behavioral health for using a justice reinvestment model. We have a DOJ Community-Oriented Police Services COPS grant for Florence that was recently awarded for $74,000. And we have a number of pending grants. A U.S. Bureau of Justice Assistance, a comprehensive opioid stimulant and substance abuse program that the Sheriff's Office applied for $750,000. A U.S. Justice Assistance body-worn camera program for the Springfield Police Department for $120,000. And a juvenile justice delinquency prevention juvenile treatment court program for their RAP court, $900,000. And U.S. violence against women for the fiscal year 20 improving criminal justice response on domestic violence for Lane County and Parole and Probation. That was submitted for $499,000. And then there are a few others that I will make available to you in writing. But I want to share these because we leverage the good work of LCOG and Denise Walters to help submit these grants. And over the years have been very successful in bringing in a lot of federal and state funding that she has just been very instrumental in. So with that, I will turn it back over.
Thank you. Any questions or comments from commissioners? Commissioner Farr.
Just a chance to thank Paul for all the work you've done for as many years as I can remember surrounding public safety coordination. But I have a quick question. It's not a question, just a comment. I'm intrigued by your statement, Paul. We have all of the players at the table at PSCC to engage in the work of racial equity in public safety. Don't need to answer much about that right now. That's an ongoing program, but I'm intrigued and I will be attentive to the work plan on that. So thanks for bringing that forward.
Commissioner Burney.
I too will be attendant to the work plan on that and seeing how much it affects the distribution of resources in our county, who those resources go to, the demographics of who you're hiring with all these grants, et cetera.
Mm-hmm. Sounds like a lot of good work is happening. So I also extend my appreciation to everybody on the Public Safety and Coordinating Council and to you, of course, Paul, for your leadership. All right. If there's no other comments or questions, I will ask if there's Commissioner Bozovich.
I was going to move approval of Order 2010-0603 in a matter of revising the 2019 to 21 Community Corrections Grant and Aid budget.
Second.
Third. I moved by Commissioner Bozovich.
I'll second that.
Somebody has some serious feedback. Any discussion? Okay, seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. Thank you very much, Paul. We'll move on to the next item, which is item 9B, Order 20-10-06-04, in the matter of approving allocations totaling $284,782 for 2021 Rural Tourism Marketing Program projects in the cities of Crestwell, Cottage Grove, Coburg, Junction City, Bonita, Dune City, Florence, Lowell, Oakwood, and Westfern. With us is Austin Ramirez, our Community and Economic Development Director.
Good afternoon, Chair Buck and Commissioners. Thank you for the time today. The item before you is the Rural Tourism Marketing Program, or RTMP. This is a longstanding program designed to invest transient room taxes, TRT, back into the rural communities that generated them. So these funds are required to focus on a few different objectives and criteria, mainly to maximize attraction of visitors to rural communities, the length of stay by these visitors, countywide visitation, as well as return visits to these rural Lane County communities. For our rural communities, tourism is a critical component of economic prosperity and one that has been hit especially hard by the pandemic. While rural hotel stays have bounced back quicker than hotel stays in the metro area, we still have seen a significant decrease overall, and consequently a decrease in the RTMP funding available. To illustrate that, from 1819 to 1920, we have seen a decrease of $1.7 million. And given the ongoing pandemic, we expect these negative impacts to continue. So this is problematic not just for businesses in the tourism and hospitality industries, but also the rural communities who rely on TRT as a revenue source, which historically has been stable, if not increasing. So these RTMP funds are invested in a wide variety of impactful ways. Some examples from the cities include In Coburg, they have used RTMP to fund a rare AmeriCorps position dedicated to rural development, similar to Alexandra Corvello here at the county, as well as starting and developing their Main Streets program. In Cottage Grove and Cresswell, these funds support marketing efforts, community events, as well as both chambers of commerce in those cities. In Dune City, these funds were recently used to help acquire 48 acres of land for a Silk Coos hiking and biking trail. In Florence, these funds have been used to propel the Revision Florence project, fund marketing efforts, support the Florence Chamber of Commerce, and continue the development of the Florence Event Center. In Veneta, these fund the Veneta Chamber of Commerce, Downtown Farmers Market, as well as other marketing efforts. So as you can see, the RTMP funds are used in a variety of economic development efforts to support several types of partners throughout rural Lane County. Many of these efforts and partners have been negatively impacted by the pandemic, making the RTMP resources all the more critical at this time. We obviously hope that hotel stays and our hospitality industry bounces back and returns to normal. When that will happen is hard to say because so much of it is based on continuously changing consumer behavior and spending patterns. And so while some of our rural communities have seen an influx of visitors, many tourists are still avoiding densely populated areas like our urban core. So, really given the impact of these funds for our rural communities and the way they rely on it, we are recommending that the board distribute funding as outlined in attachment B. This is a big topic, so I'm happy to answer any questions that the board may have.
Thank you very much. Any questions? All right. Well, I want to thank you for putting this together. It is so critical that we get funds like this out to our rural communities. They need it now more than ever. Commissioner Burney.
Thank you, Chair. I realize I should have tried to raise my hand before your concluding remarks. I apologize. Austin, can you tell us what the 2020 allocation amount was?
Let me.
So we get a frame of reference, right? Because you're talking about how it's diminishing so much.
Yeah, let me pull that up for you. Give me 1 second.
And as you're doing that, I want to forward you the name of a gentleman who provided input at last week's Board of Commissioner meeting from Blue River, who is an owner of a resort there and has a big background in community and economic development, so you can plug him in to whatever is happening in that community.
Thank you. I will. Is that Chris Lavoie, by the way? I know Chris from.
Say no more. It's done.
Okay.
So people don't know, Austin's heading up our housing program in the recovery for the Holiday Farm fire. So he's got double duty.
Thank you. I'm having trouble opening last year's board packet, but I can tell you that in the previous fiscal year, a little over 12.4 million was generated by all of the cities, right, in terms of TRT. And in this previous year, we are looking at 10.7 million. So that's where we're seeing that reduction of approximately 1.7.
So is it relatively the same kind of hit that this program is taking?
It's proportional.
Okay, that answers the question for me. Thank you very much. Thank you, Chair.
Any other questions? Okay, I don't see any. So I will entertain a motion to approve Order 20-10-06-04 as presented.
So moved.
Second.
Okay, there were multiple things happening. I heard Commissioner Burney make the motion and second by Commissioner Farr. Any discussion? Commissioner Bozovich.
I just want to note real quickly, for those folks that talk about Siuslaw County and some of the unfair distribution of tax revenues, like to point out that there's a lot of TRT generated in West Lane, and I will point out it comes back to West Lane. If you look at that pie chart, the majority of that money is coming into Florence and Dune City. So it comes back proportionately. You're not getting cheated out of your share, and it does get reinvested and is doing good things down there in Florence.
Commissioner Farr.
Thank you, Chair Buck, and thank you, Austin. I spent much of the day on Saturday in Dune City, enjoying that community. And, you know, the work that you've done there is really evident by the welcoming nature of the community, including a wonderful county park. And I will tell you that there's a preponderance of state.
No, thank you.
Okay, if there aren't any other discussion, I will call for the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you.
Thank you so much.
We'll move on to county administration announcements.
Thank you, Chair. I have a couple of things I wanted to run through, just a few minutes, so hopefully we can get you to the break on time here. First, an elections update. Out-of-state ballots were mailed yesterday, and that was the statutory deadline to mail out-of-state ballots. Voter registration deadline is next Tuesday, October 13th. There are nearly 270,000 active registered voters in Lane County. Again, next Tuesday is the deadline for registration. There are three convenient ways to register or update your voter registration. First, you can go to OregonVotes.gov/myvote for those who have an Oregon driver's license, permit, or ID card. So OregonVotes.gov/myvote. The second is you can deliver a completed paper registration card to Lane County Elections. The blank cards are in the plastic sleeve at the drop box off at our drop box on Lincoln Street. The drop box is currently open to receive completed cards. And third, you can mail a completed card to Elections. So you can also confirm your that you're properly registered by checking OregonVotes.gov/myvote at any time. Local ballots will be delivered to the post office for mailing next Thursday on Thursday, October 15th. So delivered to the post office on Thursday, October 15th, and local election information is available on our website at lanecountyor.gov/elections. You may have seen the reporting from Reuters today that over 4 million voters in the United States have already cast ballots. That's approximately 50 times higher than it was in 2016. Of course, a lot of things different than 2016, but gives an indication of voter turnout that is expected nationally. And of course, here in Lane County, we have really good voter turnout and have for 25 years had a very accessible and secure vote by mail system. Second, I want to just provide a brief update as we committed to do for the board on funding, that CRF funding and other items that become available. So as the board knows, the state has made available some of the coronavirus relief funds to cities and counties under 500,000 population. The federal legislation allows for those over 500,000, which I think is just Multnomah County, City of Portland, and Washington County, direct allocations. And the rest of the cities and counties did not receive a direct allocation. And so the state made a portion of those funds available for reimbursement. So we have to track our costs for things that we've already spent and then submit reimbursement to the state for that. To date, we, well, let me say that we've received $735,000 from the Oregon Health Authority to our Health and Human Services Office for Behavioral Health Services. That came from an e-board appropriation back in June. Another new item is our third CRF reimbursement was approved, approximately $1.2 million. And the third is an action last week that the board took to approve $2.25 million in community-oriented projects. Again, these are funds that we're submitting for reimbursement from the state that we can allocate to community-based projects. So the bottom line is that we are about $12.35 million in CRF spending out of a total pot of resources just north of $16 million that was allocated for Lane County. I want to make it clear that these are reimbursable costs. So it's not new money that comes in that we find a project for. We've spent money on various response efforts for COVID-19, and then we go seek reimbursement for those reimbursements from the state. An example of that, of course, was the purchase of the 100 River Avenue facility that we paid for out of county resources and then went and sought a reimbursement from the state for federal funds. We are spending approximately $1 million a month in COVID-19 related potentially reimbursable expenses. And so we do believe that we will come very close to, if not completely exhausting, that $16 million state allocation that they have made available. So I know that was something that the board has had on your radar, and your direction to us was to make sure that we were aggressive in tracking our costs and seeking reimbursement for all eligible expenses from the CRF funds. Of course, we're doing that as well on the wildfire side and tracking our expenses. And then the FEMA reimbursement process is much more lengthy. I'll just make a note that, as Mr. Hurley said earlier, we did have a visit and an opportunity to meet with the city manager from Malibu, California last week. And it was she was touring the state of Oregon, meeting with various local communities with Oregon Emergency Management, talking about the major wildfire that they had in Malibu that destroyed over 1,600 homes in the area. There were about 500 homes in the city of Malibu destroyed, another 1,000 outside in the unincorporated areas. And so she was sharing 2 years into that recovery effort where they're at. And it just painted what was really a very clear picture about this long-term recovery. Again, in the city of Malibu, they lost about 500 homes were destroyed. Of those 500, she reported last week that 11 have been built, and approximately another 200 have been permitted, but have not, and maybe in some phase of early construction, but not built yet. And another 180 to 200 are in the permit process. So, and again, they're 2 years out. Now, California, as Commissioner Burney, I know at the very least can attest to, the California Coastal Commission and development regulations in that area are extremely restrictive. We learned a lot in terms of what the city of Malibu did to work with residents and allow for expedited permitting if individuals built within the same footprint and the exact same structure that was destroyed. They allowed for an expedited process. If they wanted to rebuild something new, then they had to go through the traditional, more extensive process. So there's a lot, and we're doing follow-up with them to learn from that experience. But I just paint that overall picture for you as an example of really the long-term challenges given the destruction, the need for cleanup and environmental remediation, the processes and the funding through various state and federal sources. So again, just to come back to the point about reimbursement, that we're actively tracking all of our costs for FEMA reimbursement, but that process is rather lengthy on the fire side. So that's it. Unless you have questions for me, just want to provide, we'll continue to do weekly updates on elections until we get to the election. So the board and the public can tune in for that, and continue to update you at each of your meetings on COVID and the wildfires.
Any questions? I'll add that I was in that conversation with the folks from Malibu, and that was very enlightening. They've been through pretty much everything that we are going through, and their reflections on stages will help us navigate this recovery process. So I appreciate them coming down and speaking with us and the EOC crew. Commissioner Burney.
Maybe I heard incorrectly, Steve, but I heard Dan talk about Santa Rosa with 11 homes being rebuilt. So did Malibu and Santa Rosa have exactly the same low number of homes built subsequent to their fires?
I didn't catch Dan say Santa Rosa, so I missed that. And in it, Chair Buck, I'll look to you. It may have been that he misspoke on that. It was Malibu, the city of Malibu, that had a major wildfire 2 years ago. It was November of 2018. 500 homes were lost in the city, and then again another 1,000 to 1,100 in the unincorporated areas surrounding the city. So when Dan said, I believe he was referring to Malibu when he said 11 homes have been built. Yeah.
No big deal. I was being tongue in cheek. I'm sorry to take our time.
Any final questions or comments for our administrator this morning? All right. Any other business? I will just mention that we will have another emergency session this afternoon on the same item we had this morning. Apparently there's some staff changes on the time frame of the emergency declaration that we need to address before the day is up. So look for a slightly modified agenda for this afternoon. If there's no other business for this morning, we are in recess. Thank you.